Hey everyone, it's Dr. David here from El Paso Manual Physical Therapy. It is so good to be live with you right now. I'm going to be answering a comment from somebody who commented on one of our videos recently. This is a comment from Nan Clara, and she asked, "My knee hurts when I stand and cook for an hour continuously. Otherwise, walking is okay. Please help." So, I'm going to be doing videos like this from time to time. I don't have a set schedule on what it's going to be like. You're going to get them when you get them at this time. I got a busy schedule with patients and family and everything, but I want to help you out. So please continue to comment on our videos. And of course, if you haven't subscribed and you're looking for help with knee problems, back problems, hip, ankle, foot, wrist, knee, ankle, wrist, knee, hand, I'm sorry, then jump on there and ask questions. I love to get your questions so I can get more ideas for how to make our videos and how to help you get relief from these pains that you're dealing with. So let's get into this. She asked, "My knee hurts when I stand and cook for an hour continuously." Let's break down that part first. Because when you're standing, if your knee begins to bother you, you're probably using a bunch of your postural muscles to stand up and support yourself. I've got my skeleton here. Here's the foot, here's the knee joint, and here's the hip joint. So when you stand up, everything's stacked on top of itself, right? Usually people are quadricep dominant, meaning the muscles in the front of their thigh here are doing most of the work. So I want to ask you, Nan, are you using your quads? Do you feel like those muscles are working? If you're out there and you're getting pain when you're standing, but not really when you're walking, then I would guess that you're probably tightening up the quads more than you should. And this might happen subconsciously. You don't know that it's happening necessarily, but you're doing it. And when you do that, when you tighten up the quads, those quad muscles attach to the kneecap and can shove the kneecap up against the thigh bone and add a lot of compression there. That can irritate the cartilage back here. And then the other thing that could happen is that kneecap attaches to the shin bone, the front of the shin right here, and it can the quad muscles can pull up here and pull up the shin bone and compress the joint space right here. So you can get compression in multiple spots. And it's a big deal if you compress this big joint, because right here where I'm sliding my fingers is the meniscus. You have a pair of meniscus in each knee, and you can compress them too much. And especially if you've got old meniscus injuries or meniscus tear, and then you go stand for too long and you've got over dominant quads, you tend to use those quads more than you should, then you're going to be compressing those knee tissues and it's going to become irritated the longer that you stand. Now, the fact that you said when it's continuous, when you stand continuously, especially if like you're cooking, which typically isn't too active. I mean, you might be pacing around in your kitchen, maybe carrying some heavy pots and pans, but then you're, watching water boil, or you're stirring a pot, or you're standing at a counter doing some stuff on the counter. So it's not like you're carrying heavy stuff the whole time or going up and down stairs. So that tells me that you're probably in sustained postures, in the same posture for a while. Then if you're quad dominant, which means you're going to be glute weak, you're going to be weak in your glutes, which translates to that increased pressure, because if your quads are dominant, you're going to compress the knee joint, the kneecap, and then the knee joint right here between the thigh bone and the shin bone. That's probably why you're getting the pain. Now let's get at the second half of the question. Why is walking okay? When you go walking, you're using the muscles intermittently. You're not using them as continuously. Your quads will engage, and then your hamstrings will engage, and then your butt muscles will hopefully engage as well. And that's going to offload the knee. It's not going to compress it as continuously. So you may be okay. Now, I would venture to say that if you go walking for like an hour and a half or 2 hours, you're probably going to run into knee pain at that point, because then you're compressing the tissues in the knee joint quite a bit. So it comes down to a muscle imbalance, Nan. What you're dealing with here is a muscle imbalance. You've got to get your glutes stronger. And what I would advise you to do, here's the tip on how to get better at knee pain whenever you're just cooking, when you're continuously cooking. I want you to think about tightening your butt muscles, because there's a cool reflex that will shut off the quads. It's called reciprocal inhibition. You can look it up if you want, but trust me, I'm an expert at this. When you're standing up at the counter, I'm just going to tip this down a bit. Oh, we got Rosa Jamie on. Hi, Rosa. I'll answer your question in just a bit. If you're standing cooking, say this is the stove or the counter in front of you. Let's look at my knees here. If you're quad dominant, you're probably locking out your knees, which is going to make these muscles tighten up and add that compression like I was talking about. You're going to compress the knee joint on the front, and then within the inside of the knee joint, the more you lock out your knees and you tighten up this muscle. But if you tell yourself, let's use the butt muscles instead. So if you think tighten back here, you see what my hips do? They just slightly go forward. And what my knees do when I engage the muscles is my knees kind of bend. You see how they're more straight? It's hard to tighten your butt muscles and lock out your knees at the same time. You can, but your body naturally wants to just bend your knees, which shuts off the quad muscles here and allows them to relax and not be so dominant, adding a bunch of compression to the kneecap and the shin bone on the femur, on the thigh bone. So here's how you do this. If you're just standing around the kitchen, think about squeezing your butt muscles. Now, if you're doing this for the first time, I want you to stand up. Tighten your butt muscles. You can put your hands back there if you want. Just squeeze them as hard as you can, 100%. Hold it, and now back off to like 50%. So just lighten up a little bit, and then back off to like 20%. You might just subtly engage them. If you can hold that 25 to 50% glute muscle contraction for a few minutes at a time while you're cooking, that is going to save your knees. Watch and try it out, Nan. If you go, say you're going to be in front of the stove for the next 10 minutes when you go cooking next time, see if you can do it that whole time. I'm willing to bet that you're going to have less knee pain by the time you get to that hour of continuously cooking. I'm not saying it's going to go away completely, but it should begin to reduce. It really just depends on how irritated your knees are. If it's cartilage, if it's a meniscus, if it's other stuff, it's a combination of things. The results are going to vary depending on your specific situation. But the principle here, like the overarching principle that affects most people, is when you use your glute muscles more, you'll use your quads less because of that reciprocal inhibition reflex, and then that will set you up to take pressure off your knee joint. You do this naturally when you walk, because when you go walking, your muscles are all working continuously, and you don't put as direct continuous pressure on your knee joint, so it feels a little bit better when you're walking. I hope that helps, Nan. That's the explanation there. Please comment on here if you have any questions. I have a few comments. I'm going to address those, and then we're going to end here in about 5 to 10 minutes. So Rosa Jamie, hello Rosa. It says, hi, mine doesn't hurt. I need an adjustment knee and hip replacement. I slip in tub of the butt. Oh, I'm so sorry. Last year and this year, I'm so sorry that you slipped and fell in the tub. That's no fun. I've helped patients that have had that situation. Heard some horror stories of people that got stuck in the tub for a long period of time and had to get 911 help and have somebody embarrassingly come and help them out. But please get stronger so that doesn't happen again. If you've had a replacement or if you're looking to get a joint replacement, make sure that either if you're going to get one or not, get stronger no matter what. A key thing with joint replacements is they don't make you stronger. A lot of surgeons don't tell people this. They just say, oh yeah, we'll fix your joint. The pain's going to be gone. You'll be walking. And that's mostly true. But if you don't get stronger in the right muscles after your surgery, then you're going to end up with balance problems again. And it's going to wear down the replacement, which is going to set you up for the second surgery potentially. Or some people just still have pain. The worst situations we get here are people that go for a joint replacement, like a knee replacement or a hip replacement, and then they come back saying, I should have never done it. I felt worse afterwards. And most of the time I'm telling them, look, you probably had severe arthritis for them to pull the trigger on authorizing you to have a knee surgery like that or hip surgery. Now you got to fix the strength. That's the reason why you're still having pain. It's not necessarily because the surgery was done wrong, although that does happen at times. But let's give the doctors the benefit of the doubt, right? They're doing the best they can with what they know. Hope that helps you, Rosa. We got Carmen and Sheila. Carmen, my knee's burning inside and hurt when I am walking. This is a good one. I'll have to answer this too. And let me see if Sheila's got the same question. My knee and hip give way while I'm walking. Similar. Okay, this is good. I'll answer these last two questions, and I got to go, guys. I got to go get to treatment. If your knees are burning on the inside, so and comment here if I'm not understanding this correctly. So if your knee's hurting right in this area when you're walking, there's a bunch of different reasons why your knee can hurt. There's all kinds of tissues inside the knee joints on the inside of the knees. It could be the meniscus, it could be the tendons in the area. So just to show you the knee joint, the meniscus is right there. There's tendons from the muscles that come into that area. There's a big nerve that runs into the area. The femoral nerve has a branch called the saphenous nerve that runs into this area. And the point that I want to make to you here, Carmen, is that if your knee tends to go inwards here, when you're walking especially, then you're probably overstretching the tissues here. And that is likely what's going to cause you that burning sensation. The fact that you told me burning makes me think that it's likely a nerve problem. And that saphenous nerve comes off the front of the hip here and it runs this direction and it fans out over the front of the knee and is often the reason for knee pain in the area, not necessarily a meniscus problem. Whenever we get people in here that think they have a meniscus tear and then they go to the doctor and get an MRI and the MRI shows that it's clear, but they still have pain, what the heck? They're very concerned and confused, and the doctors are saying there's nothing I can operate on. And then we check it here and it's a flared up saphenous nerve. And the reason why it gets flared up, if you're walking, if your knees tend to collapse inwards like this, then you're going to tension that nerve on this side. And a quick test that you can do, if you look at my knees here when I sit and stand, make sure I don't bump into the table here. When you sit and stand, you should go out with your knees like this every time. So on the way down, knees should go out. And then right before you stand up, you should put your knees out and stand like this. Of course, be modest if you're a lady and you got a skirt on or a dress. But what I see a lot of people that have this kind of inner knee burning pain or inner knee problems, they've got this same muscle imbalance that I've been describing for Nan's question, the original question that we're covering on this video, but it's showing up differently for them. Instead of the pain when they're standing, now they're getting pain on the inside of the knee because when they're in the habit of doing this when they stand, right before they go lean forward and put weight through their legs to stand up, their knees come inwards like this, and that's not good. And then when they sit down, same thing, knees come down this way, and then they bounce out that way, or they might even just stay in like this. But every time your knees come in, you're just stretching all the tissues right here. And it's just a matter of what's the weakest link in the chain. It could be the meniscus. It could be the cartilage in the knee. This could be setting off an arthritis problem. It could be that nerve, like I said, that saphenous nerve. You can Google that nerve. If you're in the habit of moving like that, where your knees come in every time you stand up, then you're setting yourself up to continuously irritate that knee. And it does come back to that muscle imbalance that I was describing, where your quads are too dominant and you need to use your glutes. If you try that same pattern of standing and sitting like I just described, it's hard to fire your quads the farther out your knees go. So in other words, if you point your knees in like so, if you stand up with your legs like this, you're going to be using these muscles. You're quad dominant likely. You'll feel these muscles tighten up. If you don't feel it 1 or 2 times of sitting, try standing up and sitting down 10 to 20 times, and you'll tire out your muscles. It'll tire out here first. But if you stand and sit like this, it's a lot easier to engage your glutes. You can still be quad dominant like this, but you're in a position now where your butt muscles are going to work and help you up and down whenever you sit. Plus, you'll be taking a lot of the tension off that inner knee. Now, to answer the same idea, but the different question that Sheila gave me, my hip and knee give way while I'm walking. When you go walking, if you don't have enough strength in your hip muscles, you can buckle. Your knee can buckle. It can feel like you just want to collapse that way. It comes back to the glutes. I can't stress enough how important the glutes are. They are key to getting balance and stability whenever you're walking. And it comes back like what I was saying right here on this standing and sitting technique that I was showing you. Glutes need to be driving on the way up when you stand. And then when you come down, when you descend into your chair, wherever you're going to sit, drive those knees out, because your glutes are helping you control the descent, and you're not relying on your quads to do the activity, to sit down. Now, I'm talking about muscle imbalances, but these affect the nerves, the cartilage, the meniscus, the ligaments, the tendons, all the other tissues that commonly get involved. So if you've been told you have tendinitis or a ligament rupture, arthritis, a meniscus tear, or some sort of meniscal injury, or a nerve problem, they all share a common root problem often. I'm not saying always, but from what I see here, 8 to 9 out of 10 people with these types of knee problems have this muscle imbalance where their glutes are very weak and their quads are very dominant. Doesn't mean that their quads are very strong necessarily, especially if they're having balance problems. It just means they're relatively stronger than the glutes. So their quads are doing more of the work than their glutes historically in the recent movement. All right, guys, I got to get going. I'm so sorry I didn't get to you, Carmen and Rosie. You have a couple more questions. We'll catch you next time. Bye-bye.